Hello, you guys in the patho class. This is a little bit of information on care of patients with hematologic problems, primarily anemia. So why are there hematologic problems and what causes these? And that's important to know. Some answers are impaired production of red blood cells, impaired function of red blood cells, and abnormal destruction. Obviously, red blood cells are important because of hemoglobin and carrying oxygen and tissue perfusion in terms of oxygen. So we do have some red blood cell disorders that affect tissue oxygenation. And so we're talking about anemia, obviously. And anemia is just really just a term that means reduction in red blood cells, reduction in hemoglobin, and reduction, obviously, in hematocrit, or percentage of red blood cells per deciliter of blood. And this can result from a variety of causes, from dietary problems to genetic disorders to bone marrow disease and even excessive bleeding. So those are just some. GI bleeding is the most common cause or reason for anemia in adults. Other things that happen, especially in a decrease in red blood cells, are decreases in iron, iron deficiency, decreases in B12, vitamin B12, and or folic acid, and in line with that, as you read, you'll remember a decrease in intrinsic factor that's produced in the gut. And then also just the overall decrease in the rate of red blood cell production in the bone marrow, or for some reason increase the rate of red blood cell destruction. Now, there's a disorder. I'll go with sickle cell. Sickle cell disease is a genetic disorder, and it causes anemia. Some of the other features of this disorder are pain, disability, organ damage, increased risk for infection, and early death. This sickle cell disease and sickle trait, they're different. So what we have here is an abnormal hemoglobin and beta chains called hemoglobin S. These are sensitive to changes in oxygen content in the red blood cell. So if I have a reduction in oxygen, this leads to the clumping or aggregation of the hemoglobin S and causing the sickle shape. If you'll in the book or even Google, you look up sickle, it'll show a sickle shaped red blood cell, and they kind of stick together and they just kind of bunch up and they obstruct blood flow. And this is what really causes the pain, and it leads to eventually tissue hypoxia and then more sickle cell, and it sort of kind of accumulates. So the problem here is that the prolonged progression of this process literally leads to organ damage from hypoxia, ischemia, and eventual infarction. And the hemoglobin S, the lifespan of a red blood cell with hemoglobin S is about 12 to 15 days. A lot of these folks go into sickle cell crisis, and then the organs most often affected would be the spleen, the liver, heart, kidney, brain, bones, and the retina. It's an autosomal recessive pattern of inheritance, and what you have is a mutation of gene alleles. And so in sickle cell disease, you have two hemoglobin S gene alleles, one from each parent, and it results in about 80 to 100% of developing hemoglobin S. So children of this parent, of these people, inherit one hemoglobin S gene allele and one normal gene allele, and that would be called sickle trait. And this trait can be passed on in mild manifestations to your children. So pain's the most common symptom in sickle crisis. There's a lot of psychosocial issues, and we want to treat pain with opioids. We can treat with hydroxyurea, which interestingly enough increases fetal hemoglobin production, which decreases the rate of sickling red blood cells. We want to hydrate, very important. Infection, and sometimes that may relate to a spleen or a splenectomy. We want to give oxygen, and if necessary, we want to give transfusions of red blood cells. I'm not going to talk about glucose 6-phosphate dehydrogenase deficiency anemia. I want to talk about that. Iron deficiency anemia is the most common one. 2 to 6 grams of iron is normal, but and other problems come from bone marrow deficiency, issues with the spleen, liver, and muscle. So really, in iron deficiency anemia, we have our iron stores are depleted, and followed by a depletion of hemoglobin. Obviously, as you know when you're reading, hemoglobin is formed because of iron. So the red blood cells are microcytic, so they're small. Cytic is a cell, and micro small. Mild symptoms of anemia: weakness, pallor, a serum ferritin less than 10 nanograms per ml. Normal is 12 to 300. So you'll need to know about ferritin and what it does. So it's most common in women, older adults, and people with poor diets. So we need to evaluate for bleeding, so that's a GI assessment. Management, we increase dietary iron, red meats, egg yolk, leafy green vegetables, and about 10 to 15 milligrams a day are required. We can do oral iron supplementation, ferrous sulfate, and with ferrous sulfate we want to expect hemoglobin to go up about 2 grams per deciliter, in about, 4 weeks? Yeah, 4 weeks. And so iron can be given intramuscularly. So that's iron deficiency. So I'm going to come back a little while later, let you kind of digest some of this, and talk to you more about B12 and some folic acid deficiency anemia, and perhaps some less common ones like aplastic anemia. But for now, that'll be plenty.